Hi, everybody. This is Rich Wolitski, and I'm here at the U.S. Conference of AIDS in Washington, D.C. It's 2017, and we're here talking about the data related to HIV treatment, viral suppression, and the effects that they have on the prevention of sexual transmission of HIV. So for some of you, you might remember that a year ago, I was sitting on a couch that was very similar to this one at USCA in Hollywood, Florida. And with me at that time were some of the folks who are here on the couch here today. So we're going to spend a little bit of time talking about the data, what's happened in the past year, and some of the movement that's going forward to move us toward ending new HIV infections in the United States. So with me today, I'll start with Bruce Richman from the Prevention Access Campaign and U=U, Jesse Milan, AIDS United, Executive Director, Gina Brown with the Southern AIDS Coalition, and Murray Penner, Executive Director of the National Alliance of State and Territorial AIDS Directors. So Bruce, Murray, and Gina were with me last year. Jesse had a plane to catch and was not able to be on the couch with us last year, but we're happy that he's here today.
Thanks.
So this is really just a historic moment. This is a game changer, and we can't understate how important these data are for prevention and the lives of people living with HIV. So I think one thing is, without question, the science is conclusive and consistent. All of the research that's been done looking at this issue has found no cases of HIV being transmitted by someone who is virally suppressed. That means their viral load is less than 400 or 200 counts per milliliter of blood, or it's undetectable using standard testing technologies. So people who are undetectable or virally suppressed were not linked to any transmission of HIV with a sexual partner. None, absolutely zero in the research. So over the past year, some additional data have come out that have confirmed that, and the field has been wrestling with how best to communicate messages about the study results and also what they mean for prevention in practice. And that's part of what we're going to talk about today. So I'm going to start with you, Murray, and ask you, in the past year, what have you seen change, and what have you seen of the implications of these data for prevention?
Well, you know, it was exciting last year when we talked about it, and it's still very exciting. And I think what has changed is that there is momentum. There are a lot of people, a lot of organizations that are really picking this message up and figuring out how to incorporate it into their programming and into their messaging and into their public relations campaigns. And you know, we see drug companies that are now picking this message up and saying, here's a motivation and a way to get people onto treatment and keep them on treatment and achieve an undetectable status or a no viral load active in their bloodstream. And that's preventing new transmissions, but it's also keeping people really healthy. Mm-hmm. And so it's that momentum.
Yeah, and let's ask quickly, what does it change for NASTAD or the health departments that you work with?
We see health departments that are picking this campaign up into their messaging. So it's that same momentum. NASTAD has been involved in this. We were involved in this last year. We signed on, I think, at USCA last year and onto the consensus statement. And so nothing has changed from us, except that we are putting more emphasis on it because we see the potential of actually achieving no new infections as a result of this.
Excellent. And Gina, how about from your perspective? What have you seen happening?
Oh my goodness, it is amazing.
Yeah.
I've been doing a lot of trainings with women in the South, and they are eager to be able to take this information and bring it out to the broader community. So we're having conversations that we've never had before, engaging with Bruce on Facebook, and it's constantly there. You know, we're talking about it. We're doing something at SAC called the Lead Academy. And Bruce was gracious enough to train us on U=U, the PowerPoint. So we're able to introduce that to the people that we're training, and they are very eager to get this information. And last year, Murray and I talked about being, feeling comfortable enough to date now because we have this information.
You got some news for us,
yes,
Gina? Okay.
yes. So I'm happy to say that I am dating someone, and the person is really receptive to U=U. So,
excellent. And for people who aren't familiar with U=U, what does that mean exactly?
undetectable equals untransmittable.
Okay.
So if I have an undetectable viral load, I'm a woman living with HIV 23 years, and I am undetectable, then I can't transmit HIV to anyone. and it helps with my self-esteem, and it helps with the stigma that we, experience in the community.
So if we're mentioning U equals U, we have to go to Bruce then, who's really the driver behind U equals U. Bruce, what's happened from your perspective?
So last year at this time, we sat here, and we were sitting right across from you all, and we had the New York City Department of Health had just signed on, and NASTAD had just signed on to confirm that this is true, to confirm the science behind undetectable is untransmittable. And it was a very exciting time. Your speech, actually, your historic speech with a standing ovation to motivate people to share this information with people was inspiring. It was a tough time for about maybe 6 or 7 months of kind of fighting and pushing people to believe that this is actually real because of cognitive dissonance of what they thought transmission meant to what transmission really means. And the years of fear of HIV and people with HIV. So, but now we're in a really good place because of leaders. I mean, the leaders are actually right here with Jesse from AIDS United, supported the campaign very early on when people were afraid to touch it. It was controversial. The first nonprofit in the country to stand up with NASTAD and Southern AIDS Coalition is taking this message and training people in the South. HHS has this movement moving forward. So we're in a great place with now. We thought we'd have 90 organizations by the end of 2017. That was our plan last year. We have 370 organizations in 51 countries. The consensus statement that you all signed is in 14 languages that we know about so far. So this information, it sounds like it's important to people, and it resonates with people. And it's all community-driven as well. Community-driven and community members working with scientists and AIDS organizations to move it forward all over the world. It's fascinating.
And speaking of community, Jesse, from AIDS United perspective, you really work with a lot of community-based organizations around the country. What have you been seeing?
Well, this last year, we've seen organizations step up to the plate. Not just the national organizations, but the local and regional organizations. AIDS United has a public policy committee that's made up of 44 of the leading HIV organizations all across the country. And together, they analyzed the research, wrote a consensus statement that they all adopted, endorsing U equals U, and the organizations that agreed to it are amazing. We're talking APLA in Los Angeles, we're talking AID Alabama, we're talking Nashville Cares, we're talking GMHC in New York City and Whitman Walker here in Washington. All these organizations agreed to this statement and allowed AIDS United to issue it. So in March, we issued our public statement endorsing the research and endorsing this campaign. And now we signed on to your consensus statement.
Yep. I know. So it's definitely a lot of progress happening in the past year. And Bruce sort of mentions the HHS efforts, and so I'll say just a little bit about those. We've been working in HHS across agencies, NIH, CDC, SAMHSA, HRSA, to review the data and to talk about what does the research findings mean for prevention? How should an individual take the finding studies and apply them to their own lives, to their own decision making? And we're almost at the end of the process of coming up with key messages that translate the science into practice. And we're unveiling some of those later today here at USCA. We'll be rolling those out in the months to come, and also be having some community engagement sessions after USCA online. And if you're interested in participating in those, hearing about the messages, and most importantly, giving us your perspective and your input on what you think would be most helpful to you and your community, you can join us for one of those sessions. You can look for the information on hiv.gov. It'll be posted shortly after the conference. So now I want to kind of talk about, you talked about all these great things that have happened. Have there been any frustrations or resistance or things that you would have liked to have seen that haven't quite yet happened, or things that you're working on tackling at the moment? Look at to you first, Bruce. And I know you've got a lot of them that you're actually kind of, this is like the story of your life right now, isn't it?
What should I really say on camera, live? I mean,
but
we've overcome a lot of challenges this year. I think some of the problems are endemic of any field where you have a lot of different organizations that are competing with each other for resources and funding, and they have a certain position of power in the field. And our campaign was very new, and it was just more organized. It wasn't Sorry? Go ahead.
I guess I'm trying to ask another way, maybe. Was there any issue in particular that you found people have brought up again and again, or that's been kind of a little bit challenging to
pushback on
address?
the science
Yeah,
or
like kind of like
something?
what is the stuff that you've been having to answer and
Yeah,
respond
there's
to?
a couple of common ones.
Yeah.
One is STIs. People are worried about they'll say, I agree with the science 100%, but if we tell our patients this, we've been hearing this for a long time, if we tell our patients this, they're going to stop using condoms, and there's going to be a rise in STIs. They also say, well, our patients don't understand. They're going to lose their health insurance. They'll go off treatment, and they won't realize they could have a viral rebound to infectious levels. So we just say, you always have to use a condom. Your partner always has to be on PrEP. You are always going to be infectious, basically. It's easy to deal with that stuff because
so kind
it's
of
structural
paternalistic
violence.
kind of approach
Exactly,
and oversimplifying things.
Exactly. And people have come around. We've seen those very same clinics who said that to us a year ago have come around and actually signed on to the campaign. So
That's great. Well, I think it's one of these
movement,
things. We've got such a big change. Sometimes you need a little bit of experience for people to learn that the things that they fear the most aren't really going to happen. And how about you, Gina? You're kind of in the community all the time, talking to folks, doing work. What have you been hearing and seeing in terms of questions that people have had?
Well, the biggest thing is clients trying to convince their case managers, because case managers are the bridge between the client and the doctor. So trying to convince the case manager that it's real, that the information is real. So I get a lot of phone calls from case managers who want to know, is it real, and how do we tell people this and not be liable if something happens? And I'm just really blunt with them, and I say, do you realize that your clients are not using condoms anyway? They're not using them anyway, because they tell us this, they tell us that they're not using them. So we need to give them the information that you equals you. Being undetectable means taking your medication exactly as prescribed. It's not about taking it when you want to. You take it as the doctor prescribed it so that you can achieve viral suppression. If you have viral suppression, then you cannot transmit HIV. We know this. And to have that conversations with case managers who, for the most part, they're there to do paperwork. They're not there to really understand the science behind it. They're there to do paperwork and to do what we've told them for years to do. Make sure your clients are in care and taking their medication, not having those hard conversations,
It's kind of like what Bruce was mentioning. I think it just kind of takes time for people in the system to catch up with the current data, for people to adapt to new information, and to feel comfortable with it. And I know actually, within HHS, we haven't provided consistent messages on all of our websites and communications. Our agencies have said slightly different things about the data in their communications, and that's one of the reasons we brought this group together, to get everybody on the same page so that we're all working from the same knowledge base and we're all understanding the data and their implications in the same way.
I think it's really exciting because just as with gay marriage, just with same-sex marriage, it happened suddenly so fast and was so big, it took us, the community, a while to go, wow, this is real. We've been waiting for 36 years for this news, and it's like transformative for our lives, both on a personal and an organizational level. And now we have to help people understand, yes, it's real.
And
I know.
Like, really? Is this really true?
That's right.
So I do this every day, 24/7, and I sometimes feel the same. It's cognitive dissonance. I have this slide which I'll show later. It's so hard to keep these two thoughts in your mind. I felt dangerous for so much of my adult life, being HIV positive. I felt infectious and was so worried about transmitting, because condoms can break, even when I was using condoms. And so we've just got to shift to the right side. What I say to people sometimes, this sometimes helps, even with myself, is borrow confidence from the experts, because we're not the experts. I'm not an expert in HIV transmission risk, and so none of us are experts in HIV transmission risk. So when I talk to a doctor in Oklahoma who is saying, I don't believe this, I'll say, well, why don't you believe Dr. Diffenbach or Dr. Fauci or Dr. Cohen or UN AIDS or AIDS United or the HIV Medicine Association. I could go, then I'll list like 30 different, So I think that's really important. Borrow confidence. Don't pay attention to your own subjective feelings. We usually say trust your gut. We usually say do what you feel and what you think. Don't trust your gut. Don't. Because if I trusted my gut, I wouldn't be sitting here either. I mean, you need to think about what are the experts saying, who know this specific stuff.
And so this touches on two things for me. Like part of the reaction people have is emotional. There's kind of their gut feeling about it and unlearning what they've learned for decades. And then also there is a fact-based piece of it too, where people have legitimate empirical questions about, well, what about STIs? Well, we know thus far they appear to have no impact on the effects of treatment and viral suppression on transmission. And we had to kind of work through a number of these questions before some people could really feel that the circumstances that they were most concerned about, that their patients lived through, were not going to be an issue or a problem. And I mean, Marie, how's that you've seen with the health department? You've talked about some health departments taking the lead, taking this up.
Well, I wanted to respond to your question about challenges or
Yeah.
what concerns have you had. And I have heard this many times. I've heard, what about that one infection that might occur as a result of a message such as U equals U? And to me, you know, we don't do this with the flu vaccine, for instance. We don't say, oh, we can't put this message out about getting vaccinated for the flu, because what happens if you might get the flu? Well, the flu vaccine is, what, 50% effective or something to that effect? And so there's lots of people that get the flu after they've taken the flu vaccine. Now, granted, HIV is a little bit different than the flu, for sure. But the great thing about HIV is that we have a fantastic treatment now, and you can live long and healthy lives if you do happen to become HIV positive. And so using that argument that there might be one HIV infection and we deny everybody else this message is wrong. It's just wrong, and we've got to get that message to people. And so that one infection that I always hear in the health departments, a lot of health departments are saying, oh, we can't put that message out there because what happens if somebody becomes infected? Well, one, they'll be okay if they, you know, generally speaking, they'll be okay. And two, all these other people are going to benefit from that.
And I think it's important in terms of how expectations get set and how messages get communicated so that when those infections, if they do occur, then we can understand that, oh, this is a rare event. And like with people who've been taking PrEP consistently, we've had a handful of cases where people have taken PrEP every single day, and they became infected with a drug-resistant strain. That doesn't mean that PrEP's not good. It still is incredibly effective for the people who use it, but it's not 100%.
Well, and I think the other thing that this allows us to do is it allows us to promote PrEP. Okay, what about that one infection? Well, the way you can avert that is to have the HIV-negative partner on PrEP. Yeah. And what about the STIs? Well, the way to avert that is to use condoms consistently, if that's how you choose. The point is, it reduces the stigma, and it takes away that I'm the bad person because I'm HIV positive, and I'm going to make somebody else become HIV positive.
And I think the key thing is it's about the individual's choice. And I think our jobs are to make sure that people have accurate information that they need to make informed choices that are right for them. For some people, they actually do use condoms. And condoms work for them, and they're a good strategy. For other people, it's PrEP. For others, it's going to be treatment as prevention. And so it's for you and your partner finding the right mix of strategies that are going to protect you because you actually use them, and they're effective. So now we're going to go to the last question and kind of shift gears because we're about to get the hook. So I want to ask people, you know, thinking about this, it's been a year. I want to think forward 10 years from now. Where do you think we'll be in the epidemic as a result of this transformation? And what things do you expect to see in the future?
I definitely think we're going to see far less infections. I think there's some challenges with this, right? It's challenging to get everyone onto treatment. Mm-hmm. I mean, we know that now. We have great tools now, and we don't have the uptake that we necessarily would like to see. But I think that this is catching on so fast, and the science is so real that we're going to see a lot less new infections. I mean, dramatically less new infections in 10 years.
I think that's absolutely true. I actually, now that you've asked that question, look forward to seeing more public discordant couples. People living with HIV, like the five of us, who have a deep and long-lasting relationship with someone who's negative, who stays negative. You know, the day after tomorrow is my 29th anniversary. Yeah. My husband's negative, I'm positive. I hope that there are legions of other couples like us.
Hear, hear. Bruce?
Well, this campaign, we won't need this campaign anymore. So this campaign won't be around because it'll be common knowledge that U equals U. And I hope that this campaign will be, or this message is going to be integrated in treatment advocacy, so that we're actually seeing this already, so that treatment advocates who are also advocating for diagnostics and the care, so that people can stay virally suppressed, will use this as part of their advocacy. So it's not only do we need the treatment and the care and the services to save our lives, but this is also the way to prevent new transmissions and get us closer to ending the epidemic. So hopefully we'll see an increase in uptake and adherence, and U equals U will just be a known thing. So
Excellent. And Gina?
In 10 years, I'm hopeful that U equals U will also help impact criminalization. I live in a state that criminalizes HIV, and it impacts how people get tested. So no one wants to get tested, because if you get tested and know your status and have sex with someone, you can go to jail. So people are like, I just don't want to know. And I think with U equals U, we're going to come out of the shadows and we're going to live in the light. We're going to be so happy to we're normal. We already know we're normal, but now we're going to let the world know it. And so many people who are living with HIV will be able to come out and say, you know what, I'm living with HIV, but I'm not a criminal, I'm not a bad person, and it's going to impact stigma, and we're going to see far fewer new infections.
Yeah, absolutely.
I think all of those are really great hopes. I'm going to add my own reflections as well. I mean, I would hope, first of all, 10 years from now, that we actually have a cure, and that we really don't need treatment as prevention because we're able to cure people with HIV. But barring that, I hope that we're able to really realize the potential that's in our fingertips right now. To do that, though, we've got half of people living with HIV who are not in care. We got a lot of work to do to get us to the place we need to be. And I'm hopeful, though, that we'll make significant progress, and that 10 years from now, we'll be able to say that HIV infections, when they occur, are rare, and that we're able to support people living with HIV to be healthy and to live in an environment, in a community that does not stigmatize them, but supports them and embraces them. So with that, I want to thank everybody for being here today. It was a pleasure, as always, my friends. And I want to thank you for watching us here on Facebook Live. And to remind you that you can always visit hiv.gov for more information about this topic and anything else that has to do with HIV. Thank you so much for watching, and have a good day.